So in this session, we are going to discuss regarding the Betty-Neuman system model, mainly the assumptions, metaparadigm, and the analysis. So this is a part 2 video of the Neuman system model. So even before I start with the session, I would like to apologize for uploading a video very late. That is because of I had a lot of professional commitments, and so I apologize for the same. So part 1 video we have discussed in detail regarding the introduction to the theorist, the various concepts in Betty-Neuman's system model. Then we discussed regarding the model as such and a little bit on the analysis. So in this part 2, we are going to discuss in detail regarding the assumptions, the meta-paradigm, and the complete analysis of the Neuman's system model. So first, let us look into the assumptions of the Neuman system model. So if you are watching this video for the first time, I would request you to watch part 1 video, because once you understand the concepts very thoroughly, it is very easy to write the assumptions. And let me tell a word. In Neuman system model, from an exam point of view, assumptions or propositions related to Neuman system model is an expected question. Okay, so there are very few theories where you have the complete list of assumptions and propositions given by the theorist. So one among that theories is Neuman system model. So especially for a postgraduate student, you can expect a question on assumptions related to Neuman. And I tell you, by the time I complete these assumptions, you will be thorough, because once you understand the concepts, the assumptions are so interrelated, it is so easy for us to study the assumptions. So there are 10 assumptions given by Neuman or Betty-Neuman. Okay, so one more thing which I would like to tell you is, these assumptions are also taken up as propositions according to Betty-Neuman. I repeat it. These are actually assumptions, but the same assumptions can be asked as propositions. Okay, assumptions and propositions are interchangeably used in Betty-Neuman's system model. Okay, so why I am telling this beforehand is, if you get in an exam a question on proposition, you can explain the same 10 points, because each proposition you will understand how the concepts are interrelated. I'm just rewinding once to tell you that proposition is a statement which links two concepts together. Okay, so this 10 assumptions or the 10 propositions, you will find that the concepts are interrelated. So with this introduction, let us move on to the assumptions of Neuman's system model. So according to Neuman, the first assumption is, each client system is unique, a composite of factors and characteristics within a given range of responses contained within a basic structure. I would like to study assumptions with the diagram given by Betty-Neuman. So what is the first point telling? It tells that each client system is unique. It has its own factors, it has its own characteristics with responses which is contained within a basic structure. So Neuman's first assumption starts with the center part of the model given by Betty-Neuman. We have discussed in part 1 that this is a basic structure. So the first assumption is related to basic structure. What is Neuman telling? Neuman is telling that this basic structure is unique for each client or client system. Okay, so it is unique. We all have our own. I have my own characteristics. You have your own characteristics. I have my own set of traits. I have my own set of the various variables which I have. Okay, so the factors and the characteristics and the responses what we all have to a particular stressor is unique. If it works for me, it need not work for you. That is what Neuman is telling, because our basic structure is unique. So remember, the first assumption you have to write in Betty-Neuman, according to the picture, the center one, that is a basic structure. So what will you write? You will just write that each client or each client system, we all have our own set of unique characteristics. We all have our own set of unique factors. We have our own set of unique responses. That is because we have certain things contained within the basic structure. So that is the first assumption. The key word, basic structure, is unique. With this, we move on to the second assumption. What is the second assumption according to Betty Neuman? Many known, unknown, and universal stressors exist. I've already told you. Whenever you remember Betty Neuman's model, Neuman's system model, S stands for stress. Definitely she talks about the stressors and how the client is reacting to the stressor. So the second assumption is telling many stressors are there. Some are known stressors, some are unknown stressors, some are universal stressors. So each stressors differ in their potential for upsetting a client's usual stability level. Okay, so the particular interrelationship of variables will affect the degree to which a client is protected by the flexible line of defense against possible reaction to stressor. Though it looks little bit vague, it's such an easy point which says that many stressors are there, but how these stressors are going to affect me, it depends on my flexible line of defense. That is a key point. Say, for example, there are a lot of viruses, lot of bacteria which is present in the environment, but only for certain people they end up with certain infections. There are certain people amidst these viruses and bacteria we walk around healthy. Why? Because maybe the flexible line of defense is very strong. So, what is this assumption talking about? The assumption tells us that though many stressors are there in the environment, it depends on the interrelationship of certain variables which is going to determine the flexible line of defense. I'll give you another example. Suppose if there is a person is asked to quit from a job. Okay, the manager or the MD is telling to an employee, you have to quit the job due to certain reasons. There are certain people who end up with depression because they have lost a job. Whereas there are certain people who take it up as a challenge and they go on to get the next job. What makes the difference? The difference is because of the relationship of variables. What variable? For example, it may be the socio-cultural variable which is very strong for the second person. Maybe the friends are very good. Maybe the family relationship is very good. Maybe his spirituality is very strong. So he takes it up as a challenge and he believes that this is okay. Maybe the best is yet to come. See, that makes the difference on how a stressor is going to affect the flexible line of defense. For a person who has a very good flexible line of defense, a stressor cannot affect you easily. Whereas, if your flexible line of defense is very thin, say already this person is having a broken family. Say this, for example, this person is already, addicted to certain alcohol or certain other practices. Now, for such a person, sudden financial crisis may end up with depression and even it may end up with suicide. That is because the relationship of variables. I have put the picture here 5. What is this 5? The 5 variables. The physiological, psychological, socio-cultural, developmental and spiritual. This we have discussed in detail in part 1 video. So I am just telling you that this interrelationship of this variable will determine the strength of the flexible line of defense. I hope you have understood the second assumption. The second assumption is very simple. It tells that many stressors are there. Some are known, some are unknown, some are universal stressors. Whatever stressors may be there in the environment, the relationship of 5 variables, the physiological, psychological, socio-cultural, developmental and spiritual variable, that relationship will determine the strength of the flexible line of defense. So, assumption number 1 was the center. unique system. Okay, each client system is unique because of the unique basic structure. The second assumption is talking about the outermost line, that is the flexible line of defense. It depends on the strength of the flexible line of defense to overcome the stressors. Number 3. Each patient has evolved a normal range of responses to the environment, referred to as normal line of defense, and this is a standard by which to measure health deviation. All of us, we have our own normal range of responses. Say, for example, even physiological responses. There are certain people who drink so many glasses of water per day. For them, that is considered to be a normal response. Whereas I have seen personally certain people who drink only very little amount of water per day, because for them that is considered to be normal. Whatever it is, we all have our own normal responses, and that is called as normal line of defense. So Neuman's third assumption is related to this circle. What is that circle? Normal line of defense. What is normal line of defense? We have discussed that again in part 1 video. But the assumption is this: each patient, each person, we have our own normal range of responses, and that is called as normal line of defense, and that is the standard. Once you deviate from that standard, it is called as health deviation. Very simple, no? So the first thing is about basic structure. The second assumption is related to flexible line of defense and the stressor. The third one is related to normal line of defense. The fourth assumption. Assumption number 4 tells that when the flexible line of defense is incapable of protecting a person against an environmental stressor, the stressor will break through the line of defense. It's very simple, no? When the flexible line of defense is not having the ability to protect you against a stressor, what will happen? The stressor will invade the flexible line, and it will also invade the normal line of defense. So the flexible line, when it is not capable, suppose the immunity is very low, suppose this person is fasting and the person is not eating adequate food and fluid, okay, not taking adequate food and not taking adequate fluid, you can just imagine how easily this person can end up with an infection. That is, when the flexible line of defense is not strong, easily the stressor will invade the normal line of defense. And again, the relationship of the variables will determine the degree of system reaction or possible reaction to a stressor. What do you mean by that? It has invaded, okay. Now the stressor has invaded the flexible line. From that, it has invaded the normal line of defense. How much amount of reaction will happen? Again, it depends upon the interrelationship of the variables. Suppose for a person who is having very low immunity in this COVID period, I can tell you that a person with a very low immunity and various comorbidities will become more sick than a healthy person who has ended up with a COVID infection. Okay, why? The degree of reaction, it depends upon the interrelationship of physiological, psychological, socio-cultural, developmental and spiritual variable. So if your variables are again very strong, you will come back, you will fight and you can come back. If you have a good support system, if you have a good spirituality, if you have a very good developmental process, okay, psychologically, if you're really very strong, then the degree of reaction will also depend on that. I always remember about patients with cancer, okay, who take treatment. I have read a lot of articles where there is a difference between people reacting to that stressor. Say both the people, the flexible and the normal line is invaded, and both the patients are suffering from a similar type of cancer. But the response which is shown by these two people, the reaction which is shown by these two people, it depends on the interrelationship of variables. There are patients who approach death in a very positive way when they are spiritually strong. There are people who go into major depression and they die because of cancer. Okay, so the degree of reaction depends on the interrelationship of variables. So shall we tell the four assumptions? The first one was related to the basic structure. Basic structure, unique. That is the keyword. The second thing was the flexible line of defense. Various stressors are there, but whether it will invade or not, it depends on the flexible line of defense. The third one was related to normal line of defense. That is the normal system responses developed by each individual. The fourth assumption is talking about the invade. Once the flexible and the normal line of defense is invaded, the degree of reaction shown, it depends on the interrelationship of variables. Now we'll go on to assumption number 5. The client is a dynamic composite of interrelationship of variables, whether in illness or wellness. So I understand that though if I am well or if I am ill, okay, the relationship of variables is always there. Okay, always there is interrelationship of variables. Wellness is on a continuum of available energy to support the system in a state of stability. So Neuman talks about the concept of wellness in assumption number 5. Neuman says that wellness means there is available energy and the system is in a state of stability. So according to Neuman, when will she tell that a person is healthy? Well, that is, she is using the word wellness, and she is telling that when there is available energy, when the energy is available to keep a person stable, then you call that as wellness. Okay, so either in wellness or in illness, there is an interrelationship of variables. So assumption number 5 talks about wellness. Next, assumption number 6. We are going to the next line. See, so far we have discussed this one. Neumann discussed basic structure, she discussed flexible, she discussed normal, she discussed about the invasion. One more line which is pending is these lines, which is called as line of resistance. So assumption number 6 is related to line of resistance. Each patient has implicit internal resistance factors known as line of resistance. What is the function of line of resistance? To stabilize, to realign the patient to the usual state of wellness or even to a higher level of stability following environmental stressor reaction. So assumption number 6 talks about line of resistance. She's telling each one of us, we have our own level of internal resistance known as line of resistance. We all have our own lines called as lines of resistance. The function of these line of resistance is what? To come back, to stabilize the patient, to realign the patient to a state of normal level or sometimes even to a higher level. Say for example, let us talk about a person who has suffered or who is suffering from say arthritis. Okay, this patient, this elderly lady is suffering from say osteoarthritis. Now in this arthritis, if you're going to see, already flexible is invaded, normal is invaded. Now the person's line of resistance is being activated. So when the line of resistance is being activated, what will happen? This elderly lady is going to take medications or medicines, and she's undergoing lot of physiotherapy and lot of treatment. Now the line of resistance, what is the function of a line of resistance? To come back to a level of stability, to come back to normal or even to a higher level of stability. I'll give you another example. A person is suffering from chickenpox. We know chickenpox is a viral infection. Now once a person suffers from this viral infection, after the treatment, the person comes back to normal. Sometimes for this person who has already suffered a viral infection, the immunity is very high. Again, this person may not suffer from the same viral infection. So there is a higher level of stability following the environmental stressor reaction. So the key point is this: line of resistance helps a patient to come back to a normal level of stability or even to a higher level of stability. One more example I'll tell you. There are certain people who are very, very timid. Okay, they're very timid. But due to various stressors in life, you can find that after few years, if the person is not the same person whom you have seen, that is, this person is no more timid, you will find that this person is very courageous and very brave and able to take up. What is the reason? Higher level of stability. Why? Due to overcoming the environmental stressor. Okay, so Newman's assumption number 6 talks about line of resistance. What is the function of line of resistance? Come back to normal or to a higher level of stability. Assumption number 7, 8, 9 are very, very easy. Okay, very easy. Because assumption 7 talks about primary prevention. You know, assumption number 8 will be secondary prevention. And assumption number 9 is tertiary prevention. Very easy, no, to study Newman's assumption. So assumption number 7 is primary prevention. Primary prevention, I am sure that all of us are aware what is a primary prevention. Mainly it is used to, health promotion behaviors. The key word is health promotion and disease prevention. Okay, that is the key word of primary prevention. So you take a very good diet, or you, say as in this picture, we all wear a mask during this present pandemic. Okay, we use sanitizers. All these things, why do we do? In order to protect ourselves from keep ourselves healthy and to prevent any illness. So that is primary prevention. So Neuman gave importance as primary prevention, and she told that it is applied in patient assessment and intervention. Identify and reduce the risk factor. Identify the risk factor, reduce the risk factor. Goal is health promotion. I am sure you will write it. It is health promotion. Okay, that is, and disease prevention. Now we go on to the assumption number 8, secondary prevention. We know what is secondary prevention. The person is already suffering from an illness. So what will be secondary prevention? Taking a treatment for the illness. Okay, so secondary prevention is the symptomatology following a reaction to stressor, ranking of the intervention priority, and treatment. Find out what is a priority, list down the priority. Based on the priority, you are going to give the treatment so that the symptoms will be reduced. Easy, that is secondary prevention. So secondary prevention is taking appropriate treatment after prioritizing the sickness. Then the next one is, the 9th one is tertiary prevention. We know, in a very simple keyword, I can tell you, tertiary prevention is related to rehabilitation. So it is adjustive process taking place as reconstitution begins. That is trying to come back to a normal level. Though not to the optimum, you can't become an ideal person, but at least you can come back to a the most optimum level. That's all. Okay, so tertiary prevention is taking place as reconstitution begins and maintenance factors to move back in a cycle towards primary prevention. So once there is a reconstitution, again the tertiary prevention, the person has adjusted. Okay, say for example, even for a below-knee amputation or a foot amputation, you go for a prosthesis. Again, what is happening? Now you have adjusted. Again, you're going back to primary prevention. Okay, that is, say for example, a peripheral vascular disease patient underwent an amputation. Now this person is adjusted and living with the prosthesis. But definitely this person will take care to prevent further consequences of this peripheral vascular disease. The patient will take steps. The patient has to take steps to prevent further occurrence of peripheral vascular disease. So again, focusing back to primary prevention. The last assumption, but the most important assumption gave by Neuman, and this is a very simple one. Patient is in a dynamic, constant energy exchange with the environment. Let me tell you, Neuman doesn't say that a human being is a closed system. Never she has told. According to Neuman, a person is an open system. See, because it is an open system, only the stressor is affecting and there is a reaction and, reconstitution is taking place. So always there is an energy exchange between the environment and between the system. So that is the last assumption. The patient is dynamic. There is constant energy exchange within the environment. If anything happens in the environment, if there is a stressor, I will be affected. I may be affected. So these are the 10 assumptions according to Neuman's system model. Shall we just review it once? So what is the first assumption talking about? The first assumption talks about the basic life structure. That is, it is unique. The second assumption says that there is a flexible line of defense. The strength of the flexible line of defense will depend whether the stressor will invade or it will not invade. Okay, so that is the second assumption. The third assumption, Neuman told that we all have our own normal range of responses, you and me, and that is called as normal line of defense. The next assumption Neuman said is when this flexible line and the normal line is being invaded by the stressor, the degree of reaction shown, it depends upon the interrelationship of the variables. So that is the fourth assumption. The fifth assumption Neuman said is the line of resistance. Okay, the line of resistance, what did Neuman say? Neuman said that we all have certain lines of resistance within us. Once the stressor is invading, the function of the line of resistance is to come back to normal or even to go to a higher level of stability. The next assumption was related to wellness. According to Neuman, wellness means what? Wellness means a person is healthy, a person is having adequate energy is available in order to maintain the system stability. The next three assumptions are related to prevention. Primary prevention, the key word is health promotion. Secondary prevention, the key word is treatment. Tertiary prevention, adjusting, reconstituting, and coming back again to primary prevention. The last and the 10th assumption Neuman is telling, human being or the client is an open system, always exchanging energy with the environment. So again I am repeating, these 10 assumptions are very easy to write once you understand this model. See, every line is covered here. Basic structure, line of resistance, normal line of defense, flexible line of defense, stressors are present in the environment, primary prevention, secondary prevention, tertiary prevention, reconstitution, everything is there. Okay, so there is an energy exchange. So once you understand the model, once you know this diagram thoroughly, you can very confidently write the assumptions of Neumann system model or the propositions of the Neumann system model. So with this, we go to the next thing, the metaparadigm. So it's very easy to write the metaparadigm because now we know what are the characteristics of a human being according to Betty Neumann. So let us see what is human being. A human being can either be a client or it can be a client system. See, that is how Neumann is. We say that this theory is generalizable. We say it is applicable to not only one person. You can apply Neumann system model to a group of people, family, group, or even a community. So she says it's not only the client, the same theory can be applied even for a family or even for a community. So according to Neumann, human being can either be an individual or it can be a group. According to Neumann, client system is dynamic. Just now we told that is exchanging energy with the environment. Okay, and this client is having 5 variables. So we know what are the 5 variables: physiological, psychological. We know that. According to Neumann, client system is always in a constant change. That is because of the environmental influence and there is an energy. Always it is dynamic. It is an open system and always it is interaction with the environment. 5 variables you can write down when they are asking the meta paradigm. Physiological is related to the physiochemical structure and the function of the body. Psychological is related to mental process. Socio-cultural is related to the relationships. Spiritual is related to your spiritual belief. Developmental is related to the development over the lifespan. How easy to write the meta paradigm according to Neumann. You just have to remember that basic structure, 5 variables are there. This can be either an individual or it can be a group. Okay, always it is having an interaction with the environment, so it is an open system. Okay, and then you can say that this 5 variables, you can just explain what are those 5 variables. So very beautifully you can write what is human being according to the Betty Neuman system model. Next is the environment. Wow, how much we can write about environment in a Neuman system model, because we know in the environment only what is there, stressors are there. But Neuman has also told about three types of environment. I hope you remember that in part 1 I have explained: internal environment, external environment, created environment. So environment can either be internal or it can be external. Okay, so that is what the totality of the internal and the external surrounding a person is called as an environment according to Neumann. Again, stressors are there in the environment. Just now we saw in that picture stressors, intrapersonal stressors, interpersonal stressors, extrapersonal stressors. So you can write about the environment, you can write about the stressors which are present in this environment. It can be intra, inter and extrapersonal stressor. Again, you can write a word on what is that internal, external and the created environment. So wonderfully you can write the metaparadigm environment according to Neumann. Just remember two words: stressor, environment. Stressor, elaborate the three types. Environment, elaborate the three types. That's it. That is a metaparadigm of environment. Next is what is health according to Neumann. In today's session, I just told you wellness. So what will be the opposite of that? Illness. So wellness, illness continuum. That is, always Neumann believed that health is a continuum of wellness to illness. Health is always dynamic in nature and it is always subject to change. Why? Because why this health is keeping on changing? Because of the stressors, because of the environmental influence of this human being, the health can always keep on changing. Okay. So number one, it is on a continuum of, wellness to illness. Number two, this health keeps on changing. It is dynamic. Health is equated with the word wellness. So what is wellness? A condition in which all the parts, all the subparts, all the variables are in harmony with the whole of the client. When everything is the part, the subparts, everything is in harmony, Neumann says that it is health. Now we are going to see what is illness, what is wellness. According to Neumann, a person is moving towards illness when more energy is needed than what is available. Okay, when I need some more energy than what is available, it can end up with illness. For example, a person is suffering from dyspnea. This person needs more oxygen than what is available. That is called as illness. What is wellness? When more energy is available than needed. Say, for example, I feel healthy. I have finished all my normal routines. Now I have more energy to do something extra or to do some exercises or to do some social work. Okay, that is called as wellness. So Neumann equates health on a continuum. Wellness, illness. Always it keeps on changing. What is wellness? When everything is in harmony, you call that as wellness. When more energy is available, you are moving towards wellness. When you need more energy than what is available, you are moving in the direction of illness. So metaparadigm, I'll just tell the keywords. First one is human being. We saw that it is an open system. Human being is having that 5 variables, that is that basic structure, the 5 variables, and always there is an interaction with the environment. Environment, we saw stressor and the 3 types of environment, 3 types of stressors. Health is wellness. Wellness means what? Stability. What is that? Harmony. Wellness direction is what? When more energy is available. When less energy is available, you are moving towards illness. When the parts, the subparts, everything is working in harmony, you call that as wellness. The last metaparadigm, nursing. What is nursing? The unique profession concerned with all of the variables affecting an individual's response to stress. The role of a nurse is to assess the 5 variables in a person. We are concerned with not just the physical part. We are concerned with all the 5 variables which is affecting a client's system, especially when a person is undergoing a stress. Nursing is concerned with the whole person. It is not with one variable. It is a holistic perspective. We are concerned with the whole person. The nursing is the action which is assisting an individual, family and group to maintain maximum level of wellness. That is the goal of nursing. We have to help this particular client or the client system to maintain a maximum level of wellness and to maintain stability through interventions. What interventions? Primary, secondary and tertiary prevention as intervention. So the role of nurse is to use these three types of intervention. We should also assess the perception of the client and the perception of the caregiver. So Neuman has developed a beautiful assessment format to find out what is the perception of the patient, what is the perception of the caregiver of the patient. So Neuman has given importance to that. So it's very simple now. What is nursing concerned with? Nursing will be concerned with all the 5 variables of the particular patient in reaction to the stressor. So nursing is having a holistic perspective. Nursing, the goal of nursing is to help the person to have a maximum level of wellness and to promote stability. How do we do that? We do that by doing the 3 types of interventions: primary, secondary and tertiary. Neuman has developed a format to assess the perception of the patient and the caregiver. So if I am really following a theory-based care of according to Betty Neuman, I will assess the perception of the patient as well as the caregiver using that standard format developed by Betty Neuman. So with that, we complete the meta paradigm. So 4 meta paradigms: the patient, open system, 5 variables. Number 2, environment, 3 types of environment, 3 types of stressor. Number 3, health, stability, wellness, continuum, wellness, illness. Okay, what is wellness? What is illness? Nursing. What is the role of nursing? Health promotion. What is the role of nursing? Stability. How do we do that? We will assess the 5 variables, and based on the reaction to the stressor, we will give the intervention. If you are really following Betty Neuman's theory, I will also give and I'll assess the perception of the patient and the perception of the caregiver based on the standard format developed by Betty Neuman. I hope it is clear. Now we'll go on to the next thing, characteristics of a theory. See, there are 7 characteristics of a theory which I have discussed in detail in the introduction videos of nursing theories. Introduction videos, I think part 1 or part 2, I have explained what are the 7 characteristics of a theory. So whenever you get a theory analysis as a question in your exam, you can always put these 7 points and you can try to explain whether this particular theory is fitting the characteristics of a theory. For example, if it is a theory, the first characteristic of a theory is there should be interrelated concepts. See, in Betty Neuman's theory, beautifully Neuman has interrelated the concepts. Neuman has told what is a client, what are the 3 lines, what is the stressor, how it is affecting, how reaction comes. Wonderfully, there is an interrelationship of concepts. So Neuman's theory is satisfying the characteristics of a theory. It is logically consistent. Definitely it is logically consistent because you can apply this theory in nursing practice. At the same time, the diagram what she has given, okay, is once you see the diagram, it's not standing apart. That particular model which she has developed, it is consistent, and it is also having a logical sequence. It is not that she says A and then she talks about Z. She's talking A, B, C, D. So there is a logical sequence in her concepts discussed in the system model. It is simple and straightforward. Once you understand the Neumann system model, you will enjoy this model because you know that it's such a comprehensive model. It is such an easy model. Once you understand the basics, it is very simple and it is very straightforward in approach. There are identifiable definitions. Neumann has told what is the definition of each word. What is internal? What is external? What is intrapersonal stressor? What is a basic structure? So there are identifiable definitions. Providing guidelines for nursing education and practice, what's a worldwide Neumann system model is being used not only in nursing education but also in nursing administration and nursing practice. It is applicable in practice. So while considering the 7 characteristics of a theory, we find that Betty Neumann system model is satisfying all the characteristics of a theory, and hence it is having that position of a nursing theory. The strength of the theory, you can use it in all areas of nursing, education, administration and practice. It can either be for an individual, family, group. So that is the great strength of Neumann system model. It's not for one particular individual. You can apply it even to a group. Then I told you just now that the diagram is logically consistent. Once I study that diagram, once I study that model, it is easy for me to relate and write everything related to that specific model. So it is logically consistent. Main thing is how we use in nursing practices for health promotion. We will assess the variables, we'll see what are the stressors, and we can teach the patient how to promote their health. Okay, once understood, it is relatively simple. Many research has been done utilizing this theory. So that is the greatest strength of Neumann system model. Lot of research studies have been done, okay, both qualitatively as well as quantitatively. So that is a great strength of Neumann system model. Weakness. Weakness to specify what to say, certain critics are there. Always we'll critique a theory like that. Okay, that something has to be improved. This is not much correct. But overall, if you're going to say Neumann system model has more strength than weakness, but still to tell that it is a weakness, we can say that further clarification of terms is needed, especially the word reconstitution, especially the word created environment. It needs more clarification. Interpersonal and extrapersonal stressors. See, Neumann has told intra is there, inter is there, and extra is there. If you remember it clearly, intra means which is inside, inter means within a small circle, and according to Neumann, extrapersonal is with a large society when there is a stressor. So again, the critic is that Neumann should be more clear in differentiating what is an interpersonal and extrapersonal, because there is a confusion. Certain times interpersonal and extrapersonal are found to overlap. So she should give more clarity on what is the difference between this interpersonal and extrapersonal stressor. Another one thing is Neumann told that energy is there within the basic structure. So the critic is this: if Neumann would have enumerated what are all the various sources of energy within the basic structure, once you tell all the sources, then based on the source, nursing interventions could have been done. So that is a critic. Okay. See, Neumann has told at least this much. According to me, personally, Neumann system model is such a comprehensive model where I always admire how this Betty Neumann has put everything together. She has not left anything. Stressor she put up, environment she put up, all the lines she put. So nicely she has developed. But still, as a critic, you can say that she told there are so many sources of energy. Okay, once she could have mentioned what are they, if she would have enumerated all the sources of energy, then maybe we can plan nursing interventions so that that energy source can be remodified. Okay, so that is just a critic. Then her concept of entropy, I'll just talk about this. She told entropy and neg entropy. That is two concepts according to Neumann system model, which I have discussed in part 1. Okay, entropy is moving towards illness and neg entropy is moving towards wellness. See, if you're going to take a dictionary meaning of entropy, or if you're going to put in the Google entropy, okay, you will find that entropy is actually a closed system. Okay, so the critics have caught hold of that word called as entropy, and the critic is this: that see, entropy is the concept of entropy is actually closed, whereas Neumann system model is an open system. So why did she use entropy in her system model? Okay, so what to say? Again, I'm telling you, entropy is actually the meaning of that entropy word. If you're going to see the characteristics of entropy in general, it is a closed system. Neumann is telling hers is an open system. Then why did you put that word entropy in an open system model? That is a critic in Neumann system model. So in today's session, okay, we asked to come to a conclusion. Okay, what is Neumann system model? Once you focus on the response of the patient to the environment, and once we understand the environmental stressors, okay, two things we should understand as a nurse. We should know what are the various stressors for a patient. We should also know what are the variables which is there within a patient. Once we understand these two in a particular patient, according to Neumann, a nurse can wonderfully plan interventional strategies using prevention, primary, secondary, or tertiary, and thereby help this patient to come back to wellness. So that is the conclusion according to Neumann system model. So in this video, we have covered mainly on the assumptions, the meta-paradigm, and the detailed analysis, including the characteristics of a theory according to Betty Neumann's system model. So I pray and I hope that this video will be helpful to to all of you, especially to the postgraduate nursing students. Thank you very much for your great love, support, and encouragement.